Yeah, hi, Dr. Jason Hafron, Chief Medical Officer at the Michigan Institute of Urology. I specialize in urologic oncology. Yeah, I think advanced testing will have a significant impact on MRIs. MRIs is a great tool. It's made a huge difference in evaluation of elevated PSAs, but MRIs are very expensive. They're inconvenient, and in our area in Southeast Michigan, access is a problem. We cannot just get an MRI and send a patient, and within 1 week, he can get his tests. So there's significant delays in getting these MRIs. Frequently, patients have to travel far. They have co-pays. There's always the contrast issue. So ultimately, if we can use adjuvant biomarker testing to minimize MRIs, that would be very helpful and resonate really with the patients, because even though it's a great tool, I'm not saying it's not. I'm saying there's significant layers and inconveniences associated with this type of testing. Yeah, IsoPSA I found very helpful in helping with the results of an MRI. There's been great data published in the literature that looked at patients from the Cleveland Clinic who got an IsoPSA and an MRI, and they correlated that with positivity rates of clinically significant prostate cancer. And I find it very helpful in the PIRADS3 lesions, because what it gives you is actual number of what that means. So if a patient has a negative IsoPSA and they have a PIRADS3 lesion, their risk of prostate cancer is about 5 to 6%. However, if they have a positive IsoPSA greater than 6, that risk triples, and that can go up to 16%. So when you look at that, I think it's very helpful, because then you can have that shared decision-making discussion. So when a patient is asking you, what does this actually mean? You can tell them that their risk of clinically significant prostate cancer is 16%. So having that number, having the ability to have a meaningful shared decision-making is very impactful and very helpful, and patients really appreciate that.